For our next speaker, I'd like to introduce Dr. Lillian Duran. Lillian Duran has a PhD in educational psychology from the University of Minnesota and is a professor in the Department of Special Education and Clinical Sciences from the University of Oregon. Her research is focused on improving instruction and assessment practices with multilingual children. Prior to Dr. Duran's work in higher education, she worked for 9 years as an early childhood special education teacher. She is currently involved in multiple efforts developing Spanish language and literacy assessments from preschool to sixth grade. Dr. Duran frequently delivers presentations nationally on the topic of recommended practices in language and literacy with multilingual learners, and she has served on multiple equity and diversity councils, including the National Association for Young Children and the Division of Early Childhood. Please join me in welcoming Dr. Lillian Duran.
Thank you so much for that warm welcome. I'm very happy to be here today with all of you. And I hope I'm able to answer some questions about assessing English learners for eligibility for special education. That's primarily what I'm going to focus on. Let's see. So a little bit about my professional background. I worked for 9 years as an early childhood special education teacher myself. So I have a master's degree from the George Washington University in early childhood special ed. So I was in the trenches conducting assessments of young children to determine their eligibility for special education, really looking at their development. I taught for 4 years in PG County, Maryland. I don't know if any of you are familiar with the DC area, but basically PG County, Maryland, any direction is one block outside Washington, DC, pretty much. And then I moved from there to rural Minnesota to a little town called New Ulm. And I thought, who in New Ulm's going to care that I speak Spanish, right? Lo and behold, towns in Minnesota are being revitalized by Latino populations. Little towns like Sleepy Eye, Medilia, Arlington, these little towns of 15,000, 10,000 people. And my skills came in handy, and that really propelled my interest and my motivation to go back for my PhD, to really look at this intersection between multilingual learners and looking at eligibility for special education and also my screening efforts, right? Like, how do we do this fairly? How are we accurate? And how are we culturally and linguistically responsive to their needs? And so right now I'm a professor at the University of Oregon in Eugene, and I'm in the Department of Special Education and Clinical Sciences. Also, a little bit about my personal background. I'm from San Francisco. So I was born and raised in San California native and a rare San Francisco native. I grew up on Potrero Hill, back when there were working class neighborhoods and people could afford to live in beautiful San Francisco. And so my dad is Rutilio Duran. That's my grandma, Paula Duran. And so I grew up with Spanish in my household. My dad is from Mexico. He came here in 1911, came to California in 1911. I think it's important to know this like story of how I came to be, and all of you thinking about your stories and how you came to be, because that will be part of our talk today and thinking about eligibility determination. And this is my mother, Maria Matilda Wilhelm. She came from Germany. She was born in 1931 in a little town called Rustingen. And she came here after World War II as a German war bride with her first husband. My dad was her second husband. So it's a bit about me, why I'm so interested in multilingual learners, in supporting the state of California, and why this topic is not only a professional interest of mine, but also very much a personal interest of mine. So I like to begin my presentations. I spent 10 years in Minnesota as well. It's a great state if any of you ever get to visit, just not during January. Um, the knowledge, sensitivity, and care of the person giving an instrument and interpreting the result is ultimately more important than the specific tool that is used. Technical adequacy does not assure an unbiased assessment. And it's one of my favorite quotes when we're talking about determining eligibility for special education. In our law, it is baked in that it is a team decision, right? It isn't just about standard scores. It's about really looking at that child's educational needs, their performance across settings, using multiple data points, and including all of the team members, including the family, right? They shouldn't have short shrift and just be this secondary part of the evaluation process. We're going to emphasize today how integral they are into providing information about their child's development because they know their child the best. I also gleaned a lot of information from this report and this practitioner's guide from the California Department of Ed because I want you to be compliant, right? Special education is a lot about compliance, about making sure that we're following the law and making sure we're following your state's interpretation of the law, which varies a bit. So before designing this presentation, I vetted all of my ideas and looked up information from this practitioner's guide. The link is right here. I really encourage you to revisit it after this presentation if you have any questions. Actually, the California Department of Ed did a very nice job of putting together this guide that has a lot of pertinent, valuable, evidence-based information that you could use tomorrow. All right, so what I tried to do here is to break it down into lists because we all like lists and they help us organize complex information. So today I'm going to go through these steps to conducting a fair and least biased evaluation for special education. And I like to use the terminology least biased because it's hard to reduce all bias, right? We have to be honest in our process. The assessments we used are biased. Sometimes we carry personal biases with this. Our systems are biased. And so we're trying to overcome all of these different levels of bias in our evaluation procedures. And so to be honest, we say it's the least biased, right? How we reduce the most bias that we can, recognizing that some might be in there as we're trying to really do a fair, accurate job of determining whether or not children qualify for special education. So the steps we're going to talk through today, and again, these are in line with your CDE recommendations, is really establishing number one, that school site multidisciplinary team, including general education, English learner services, right? They are our allies and they should be on teams when we're looking at multilingual students. And I think too often they get left off of those special education teams. And we silo English learner services and special education services when in fact, when we have students who are dually identified who have dual needs, they should be working together in concert to support that child. And of course, special education staff. There might be special school psychologists involved in that, speech, OT, PT, all the folks that are involved in special education who might meet that child's needs should be involved. Two, we need to review pre-referral information, carefully considering the child's language background, their educational history, and languages of instruction. You know, these are some unique features of assessing multilingual students, which makes them different than assessing monolingual students, right? We have to really think about how much of each language have they been exposed to? At what age did that begin? What has been their educational history? Have they been in the US the whole time? Have they moved here? Do they come from a refugee camp? I mean, what has really been their educational history and where would we expect them to be? And then thinking about their languages of instruction, California, luckily, is a more progressive state. There's more dual language immersion opportunities, but clearly not all children have benefited from that. And many are in English only approaches, maybe not with adequate support for developing their English language development while they're in the process of trying to learn in English, right? And so, how does that affect their development as well? Three, we need to locate and provide training to an interpreter. I'm going to hit on this hard today because interpreters, when we're conducting special education evaluations, if you don't speak that child's language, if you don't speak that family's language, they're like the lens on your camera, right? If your lens is scratched all day, you could be taking out there taking beautiful pictures, but you can't see a thing because it's all scratched. So our interpreters often are that lens, that view into the family, into the child, their performance. And if they don't have adequate training, how can they be an accurate reflection of that child's ability? Four, we need to ensure active and meaningful family engagement, right? Not just checking off the box. They showed up to the meeting. I sent out the due process. It's really about how did I do some interviewing? How did I develop a relationship with that family? Did I really think about their needs? Was I warm and welcoming? Did they feel comfortable? All of these are really important to really actively uh, support or really enact our laws around IDEA, which are family centered and we're supposed to have families at the table in this meaningful way. So that would mean contact the family and describe the process before it begins. Learn more about the child's development from the family's perspective. And it's been my experience in public school systems. I started in early childhood where I'm like a home visitor, all family based. And it's like as soon as kids hit kindergarten, somehow that gets disconnected from that child. And I encourage those of you who work in these school age settings to try to maintain that connection with the family that gets lost far too early in our educational system. Five, determine the child's language exposure to their home language and English. So I encourage you to find those LPAC performance levels. I know they're there somewhere. We've had our own issues in our research trying to, the mysterious LPAC scores. Maybe they're not the most readily available. Maybe they're not readily available in a timely way, but at least look for them so that you can understand where that child's English proficiency is. We're also going to be talking about using a home language survey later on, and I have some links to surveys that you might be able to use yourself to really think about the child's current exposure to each language. Then you're going to develop an evaluation plan that includes an emphasis on measurement in all of the child's languages, but it'll include different types of measurement, right? I'm not saying you have to go out there and do a Woodcock Johnson in Somali. Not going to work. What I am saying is that you're going to attend to the child's language development in other areas. Can you gather naturalistic language samples? Can you at least get a report of their language and their home languages if we don't have assessments in those language? So really thinking about data triangulation. We use that term a lot in research. It's where you have a single point of data, but you also try to find other points of data that would support that information. Then 7, obviously, you're going to execute your evaluation plan. And then 8, I encourage you to go back to that multidisciplinary team, which probably a lot of you do, and review all the data from multiple sources. It's my understanding here today that we have a heavy emphasis on our reading specialists, which is awesome. But many of these kids are going to have other professionals involved, and we want to see, what did you see on this day when you assessed? What did you see on this day? What did you learn from this home interview? All of those data points together point to a child's need for special education. If a child truly has a disability, it shows up in multiple contexts and it shows up across languages, not just in one. We may have to ask Dr. Duran some questions. Okay, oh, sorry. I got distracted by the chat. um, all right, and then 9, you're going to write your evaluation report and hold the evaluation meeting. But you want to make sure that that child's family is fully informed of the results and has a meaningful opportunity to comment and add their perspectives. Again, being in special education for as long as I have, I've seen many teams approaches where the evaluation report is fully written. The family just comes in and we basically just report out everything. We seal it up and we're like, okay, that's done, right? Is that really meaningful engagement? Did they really have an opportunity to comment without feeling intimidated or like they were bothering you or that you would have to change the work you've already done? So I think we really have to be thoughtful and mindful about that family engagement at the end as well, about how their voice shows up in our evaluation report and their knowledge of their child. Again, they know their child best. We are a blip in time of their child. Our services are important, don't get me wrong, but they are their lifelong child's developmental partner. So, pre-referral and referral information. This is where, again, I think we need to have our head in the game when we're talking about multilingual learners and not just have this little paltry, like pre-referral information that doesn't tell us much about, their background. Students I've identified as English learners need more intensive and specialized academic support and the opportunity to learn in an effective, culturally and linguistically responsive environment. Took that quote right out of that manual, right? Which seems obvious. You're like, of course they do. But how often do they really experience that? We know that there's a lot of pedagogically induced disability. Albert Ortiz coined that term, right? Essentially, our instruction isn't very effective. Kids are working really hard to understand their English language instruction. They hit about 3rd grade, especially in reading. They're just beginning to come online with really beginning to comprehend what they're reading, right? We might have taught them to decode all day, but their English language development is coming online to comprehend. And suddenly they seem like they're very behind. But it might not be a disability issue, right? It might be an issue that's really related to a lack of effective instruction. So we're going to talk today about this, second, really thinking about multi-tiered systems of support framework that includes screening, observing, intervening, and monitoring progress. Now, we all know about the recent legislation around screening in the state of California. We know that there are many, that they approve for screeners, multitudes of which is one, as well as others. That is the first step. But screening, of course, does not identify disability. Screening is a first step to saying, hey, this child needs some extra instructional support. So what we would want to see is some tier 2 interventions in place. Did they do something different to support this child before we went right to a special education evaluation? So that means gen ed and special ed and teachers who are teaching English learners who have that certification, all working together to really look at what might best meet these child's needs before we go right to a special education referral. So again, this comes right out of your manual. So you have your pre-referral process. These are the data sources that the state of California recommends. Your student cumulative file checks, looking through everything that they've, what does their file look like? Extrinsic factors, right? Kids experience a lot. There's a lot going on in the world. So has there been recent trauma? Have they had recent upheavals in their life? Have there been medical issues, right? So thinking about what else might be affecting this child's development right now that might not be a disability, but has these other extrinsic factors going on. And then looking at their intervention summary. What have been those tier 2 interventions? What does their instruction look like? Has it been a dual language program, English only program? And anything you can glean about that. All of these data sources together should be in addition to really think, or should support your decision to even move forward with a special education evaluation before thinking about, well, maybe there's other things we could do again before we go down the special ed road. So now I'm going to switch a little bit to I think it was like point number 3 or 2, and that's working with interpreters. So so now we're in the scenario, we've looked at the pre-referral information, we're like, yes, this really warrants a full evaluation. I should also remind us right now that if the family at any time asks for evaluation under IDEA, we are obligated to move forward with that evaluation. So of course, we should keep that in mind as well. So now you have this evaluation in front of you, and let's say for most of you, that means, okay, I need an interpreter now to work with, this child, given the over 150 languages roughly spoken by public school children across the state of California. No one teacher can possibly speak all of those languages. So I'm going to give you some tips and a little bit of training today about working with interpreters, because too often I know myself, even in my special ed training, we receive zero training on working with interpreters. When that became a bulk of my work, believe it or not, in Minnesota, it was a relocation community, and there were many West African immigrants. So there was languages like Oromo and Anuak and Noor, and cultures and languages I was really just learning about. So in thinking about this, number one, we need to make sure that interpreters have signed something or know about confidentiality in special education. It's a primary aspect of our law, especially in areas where there might be only a few members of a community that speak that particular language, and they might all kind of know each other and network with each other. I certainly found that in rural Minnesota with populations, again, that spoke like Anuak and Noor, and we had to be really careful about confidentiality and even sometimes bring interpreters from other locations so that I could assure confidentiality for that family. Two, oftentimes the interpreters we're using for these kind of low incidence languages don't have professional training, and so they might not know about these professional relationships with the multidisciplinary team and the family. And so we need to provide coaching in that area. 3, they benefit from some training in the assessments we're going to ask them to deliver, right? Many of us are still using this model where we have a Woodcock-Johnson, or we have whatever test that we give, and we feel compelled to give that test in the other language, which there's lots of flaws. I'm going to go into that later. The standard scores are not valid if you use that approach, but it helps us gauge some idea of, can this child do this? Can this child not do this? Um, if you are using that approach, then the interpreter definitely needs some training in how to go about administering those items and what you're actually looking for in those items. And then they would benefit from some training and knowledge of, what is the special education criteria? What am I doing here? How do I be that lens that really gives you the information that you need in a clear way versus in a way that's not really understanding the process and what we're actually aiming for in this interaction? So back in 2011, a colleague of mine, Gregory Cheatham, actually wrote a great article on these 4 common challenges of interpretation. And I still like to use this because it's one of the few articles out there about challenges specific to special education interpretation. There are often addition errors, substitution errors, omission errors, and these errors around understanding interpreter roles and behavior. So Addition errors might happen when interpreters may add information based on their own opinion or own experiences. When I was in Minnesota, I, for 3 years, led the Centers of Excellence. I didn't name it, they did. And one of the Centers of Excellence was around diversity, equity, and inclusion. I'm going to say that phrase out loud right now as much as I can. Diversity, equity, and inclusion. And so I led one of those centers and I worked a lot with this these groups of advocates around the state, and one in particular was around the Somali community, right? I was learning a lot about them. And the Somali community in Minnesota is really big. And they pointed out that many times this advocate would be in meetings and the Somali interpreter would literally tell the family to say no, not out of malice, but out of real fear of the government. I mean, they had just come from a situation, these were newly integrated refugees where they were in fear of their government, they were in fear of their lives. And so, us coming in as this government agency, education, we're all kind hearted, trying to do the right thing. But they'd be like, oh no, they're going to take your children, they're going to find some fault with you. And so I was even stepping back with that interpreter with asking, do you trust us? Like, do you understand what we're saying here? And what we're actually offering. So these addition errors turn out to be a big deal, right? They're not just like adding a word here and or there, really getting, again, this goes into partnering with those interpreters. How do you understand what we're doing here? How do you understand our services? And will you make sure not to add your opinion to what's being offered and explained and communicated? So here are some strategies to reduce addition errors. Make sure the interpreter understands the purpose of the evaluation process, the assessments to be used, and what information is being gathered, and how that information will be used, right? In the interest, in the best interest of that family and that child. And then the special education services and the benefits that are being offered, right? So this takes a little bit of time with the interpreter. So I also understand that many of you probably use interpretation services, which I understand sometimes you just have to do, but that could be as easy as, can you schedule that phone call with that interpreter a half an hour ahead of time and at least go over some basics, right? If you don't have the luxury of having an interpreter that you work with all the time in your team, how can you build in some of this training in a way that fits your model? Maybe you have to book that interpreter for 2 hours and you always schedule that first 30 minutes to just go over versus jumping right in with that interpreter, thinking that they're just going to understand all of the nuances of our practice. Substitution errors. These types of errors occur when interpreters may not fully understand what is to be interpreted, and they may substitute words in their own language that may not have the exact meaning. For example, if there's no word for autism, which there often isn't in many of the world's languages that exactly fits our definition of autism, it may be communicated as an intellectual disability, and I've had that happen before. Or think of other specialized vocabulary in your field and the challenge of interpreting everything into another language and culture. Some concepts may just not have words in other languages, and they have to really build around the meaning and the definition to really communicate, like sensory disorders. Or, again, think of all of the specialized vocabulary and all of the constructs, right? These ideas we have in special education. So here are some strategies to reduce substitution errors. Review and understand, provide interpreters with time to review and understand the specialized terminology that will be used during the meeting, right? Or during the evaluation process. Work with the team to brainstorm how they will describe the concepts in the family's native language to ensure accuracy. So let that interpreter try out how they're going to explain. These evaluation meetings where we're identifying a disability are not trivial. This is important information that the family needs to understand 100% when we've completed that meeting. And then debrief after meetings. Take a minute to check in about accuracy and opportunities for improvement. Did it go well? Did you understand? Make sure the interpreter has a time to comment to you about what went well and what didn't so that you can improve your practices. OSEP does have a resource in Spanish. Download it while you can. Um, it's an excellent glossary. Of course, I wish these existed, in all of the beautiful world's languages that exist in California, but at least there's this one in Spanish. So pop on this link. It's a glossary of terminology, of specialized terminology in special education that's available in both English and Spanish. And I think it's a great resource. All right, omission errors. Interpreters may leave out information for various reasons. One, maybe because the speaker just spoke too long, right? Many of us are very verbose. We kind of go on forever. We want to explain our whole report. An interpreter can't hold that in their mind. Or two, the interpreter may feel uncomfortable delivering a particular message because the family, they know culturally it's going to be very uncomfortable for that family, maybe in a way that we don't even understand. So an interpreter may not communicate that a child has been identified with a disability if the interpreter realizes culturally how hard it will be for the family to receive that news. So here are some strategies, right? Limit the amount of time each professional speaks. Say a few sentences and let the interpreter interpret. Don't go on forever. And I think it's good for our teams to really check that. Honestly discuss how the information will be provided to the family and openly discuss the cultural interpretations of the information and the emotional response of both the family and the interpreter. If we're identifying intellectual disabilities, if we're identifying emotional behavior disorders, if we're identifying, whatever it is, it's not easy news for any family to receive. And so we need to make sure that, as difficult as it is, there has to be that transparency. And then emphasize the importance of the family being fully informed about the identification of disability and the special education services that will be provided, right? Or at least offered if the family provides consent. These are all critical and integral to really having informed consent and due process with these families. And lastly, interpreters should understand roles and professional behavior, emphasize confidentiality. Remember, under the IDEA, they're entitled to full confidentiality, reduce side conversations on both ends, including amongst professionals, and then in order to have that transparency and to facilitate relationship building and trust. There's a National Association of Interpreters of Education. There's a link right here to a code of ethics. This is something you can download and maybe look over and something you can share with interpreters in the future. That might also be a helpful resource. All right, now I'm gonna blaze on to active family engagement. It's recommended, that we adopt more of a conversational approach with families. So think about all the forms we have to fill out. Again, I was a special ed teacher for almost 10 years. We've got a gazillion forms, but how can you go about asking questions in a more informal, open-ended, responsive way? And I'll give you one example of what I came up with in my practice. I had a lot of, in early childhood special ed, we ask a lot about that child's birth, right? To understand what might be leading to a disability. So instead of going through, did you have preeclampsia? Were there complications? I opened up with a question with, tell me about the day your child was born. That just allow that family to tell a story. So in all of these bullet points here, it's really about allowing that family to engage in a storytelling process that engages the two of you as humans, right? As relationship building versus, I need to complete this form today and I've got 27 minutes to get it done. That's not a way to begin this relationship where you're going to get in deep with this family and really help them through a process potentially of understanding a disability that their child has. I talked about using open-ended questions along with close-ended questions. So I encourage all of you to look through your forms. This would be a little takeaway homework assignment and say, how can I turn this into an open-ended question? How could I turn this into a storytelling opportunity for the family? And how could I turn this into relationship building and still be able to checking off my marks and filling out my blanks on the forms that we all know that we need to complete? We also need to recognize that in many cultures, they're not so used to just talking about the sensitive information to a brand new person, right? The day your child, about your child's birth, these sensitive issues around family dynamics, other things that we need to get into. So really think about using your interpreters who might inform your culturally responsive practices. Ask some questions about how sensitive the family might be culturally to these questions. And again, adopt a more conversational approach whenever possible. Also, when we're thinking about culturally responsive practices, include extended family members, right? It's not just about the nuclear family in most cultures. We have grandmas and grandpas and tias and tios and all sorts of folks involved in raising the child and older siblings. So think about the vital roles that these individuals play. Invite them to the meetings. Make sure they're present. Ask the family who should be present instead of just assuming this nuclear family setup. And I've already gone over bullet point number 7. All right, so now we're going to shift to how do I decide what language or languages to test in? There is no silver bullet here, so really I'm going to talk to you today about a process to follow and a mindset to adopt, okay? So in IDEA, the language around this is language of assessments are provided and administered in the child's native language or other mode of communication and in the form most likely to yield accurate information on what the child knows and can do academically, developmentally, and functionally, unless it is clearly not feasible to so provide or administer, right? And I always say that last sentence was the lawyer being like, it's this case can't do it, put that in there. So but I think the most important part of our law is in the form most likely to yield accurate information. That is the bullet point there, is that we know there's all sorts of complications in our systems, who we get for interpreters, the limitations of the assessments we have available, which basically we only have assessments right now in English and Spanish, right, that we could administer. We don't have assessments in Hmong and Vietnamese and Mandarin and all these other languages for special education eligibility determination. But what we are trying to do is gather information in a form most likely to yield accurate information. So think that through, right? From your guide here, it says testing and assessment materials and procedures used for the purposes of assessment and placement of an individual with exceptional needs are selected and administered so as to not be racially, culturally, or sexually discriminatory. So that comes right from your practitioner's guide. It's easier said than done because we have a lot of flaws in what's available to us. So let's think through the process. So here's what I would go through in thinking about the child's language exposure and background and how to decide what language to test in and how much assessment to do in each language really is the question. So I would try to find the child's most recent LPAC scores, like where is their English language proficiency at? Or what do you know about how much English and how much home language is the child currently exposed to, right? Are they in a dual language program, the English only program? Are they pretty much bilingual at home? Are they focused on their home language at home? Um, and then what has been their language of instruction throughout their schooling? So again, going back to the language in your practitioner's guide, it says here, an assessor fluent in both languages should determine the student's relevant strengths and weaknesses in her primary language and English to guide the assessment team regarding the types of assessment the team will perform by using like instruments in primary language and English when available. This helps to provide a more comprehensive view of what the student knows and can do. So right here in your law, it's saying that we should provide assessments in that child's home language and English, that they should be like between their primary language and English. Honestly, the only assessments that exist right now that are like are in Spanish and English. The rest of it, you're interpreting assessments or you're doing natural language samples or other modes to look at these other home languages. Right here, from the U.S. Department of Education, they have a great website. Again, pull this down while you can on home language surveys. There's many resources here available on excellent language surveys to use and incorporate into your work. They're printable. They're available in Spanish and English. I don't know if they have other languages available, but California has lots of resources for interpretation. So you could pull these down and at least add this to your file, like your go-to file for how I conduct eligibility determination with multilingual learners. There should be a home language survey in your packet. So download one of these so that you get better information about that child's current language exposure and you involve that family in telling you what language or languages they're using at home. And then how do I decide what language to assess in? So you want to ask, what is the child's dominant language based on home language survey and performance in the classroom? We can use information about language dominance to decide how much and what kind of testing or information gathering we can complete in each language. But we want to know how they're doing in multiple languages. It's not like we just choose one and that's it. We at least need to gather home language samples, like I said, or have an interpreter move through an assessment that would give you some information about their performance in their home language, an informal play activity early on, maybe with a kindergartner, those types of activities. If a child has a language disability or delay, it will be in both languages and not just one. So you should be hearing reports from family about maybe articulation errors or maybe not as much language as other siblings or cousins in the family, in addition to issues that you might be seeing in English. Remember to consider cross-linguistic influences, like differences in articulations of sounds, because sounds are different in other languages, right? And they might be applying the sound system of their more dominant language to English. Or even grammatical differences, right? The child might say the car red because in Spanish it's el carro rojo instead of the red car. So think about how that child's grammar might be being applied to English. So that's not a delay, that's just a difference. So here are some options in addition to standardized assessment. Many of these show up also in that CDE manual. So family caregiver report, number one, observations as much as you can in natural settings. That means getting into their classroom, looking at how they're engaging in lessons, getting some work samples from their classroom, right? Whether you're looking at math or in this case, literacy and language arts. What has been some of their work samples over time? What can you glean from that and their learning trajectory? Thinking carefully about those MTSS frameworks, right? So California is an MTSS state. We have screening in place now. So think about what happened pre-referral. What were interventions like? What were their instructions like? Was there some data collected over time that you can review? Thinking about dynamic assessment, if you're really working with a child, maybe who's newly arrived in the US, you're worried about disability but not sure, how much can you use a test, teach, retest model, which has been widely endorsed for multilingual learners to really look at their ability over time and to give them an opportunity to learn. And ultimately, these strategies may be more effective and meaningful than a standardized test alone, especially when you violated the standardized norms by using an interpreter to administer the assessment in a language that that test wasn't even developed in. So right here from your CD Practitioner's Guide, no single measure or assessment is used as the sole criterion for determining whether a pupil is an individual with exceptional needs or determining an appropriate educational program for the pupil, right? So right there in your law and your California interpretation of the law, here are some other options in addition to that single standardized score. If you administer English language assessment through the usage of interpreter, remember those standard scores are not valid. So even if you report them, you have to put a cautionary tale that you used an interpreter, these norms were not validated, and so that cannot be the sole determination of disability identification. There's cultural and linguistic bias in the assessment. Items on the test may not be familiar to different, think about common foods, household items, animals, right? So even though the test, you might just have translated the expressive vocabulary section, the items were not normed on that population and there's bias in them. You need to consider that language items may not be functionally equivalent, right? So we might be looking for grammatical features that are in English in those language sections. And we, in fact, are like ing endings, ed endings, plural endings, right? Passive tense, whatever it is as we're moving along the trajectory of language development. It's not like that exists in Amharic and Oromo and Hmong and Mandarin and Vietnamese and Korean, right? So we can't just translate a language section and think we're gathering any information about that child's actual language development in their home language. So let's give up on that idea and instead really think more about naturalistic language samples. Can they use language functionally in their home language? Are they intelligible in their home language? Are they communicating based on community norms in their home language? And this is going to give us much more information about their home language development than translating an English language section. All right. In your manual, in your practitioner's guide, they have excellent tables around comparison of language differences versus disabilities. I have this much time to talk to you today. Obviously, I could do a full day, half-day presentation on special ed identification, but go to your manual because actually CDs did some really nice work for you. Um, and they have some ideas of like, if this is the learning behavior manifested, what would be indicators of language difference due to a second language acquisition issue? And what would be really more an indicator of possible learning disability? Go to these tables. There's like 3 pages of them. Excellent information to help you sort out some of those issues around language difference versus disability. All right, recommendations for the evaluation report. Here are some recommendations for the components of the assessment report for an English learner. Again, I took this right out of your manual, so you're following your laws. You need to think about, there's really nothing here I haven't talked about, but I wanted you to have that from your manual. Again, it's thinking through the multiple sources of data, thinking through whether there's a discrepancy between achievement and their ability that cannot be corrected without special education related services. Again, that gets to your MTSS frameworks. A determination concerning the effects of environmental, cultural, or economic disadvantages where appropriate, right? So again, really thinking about that child holistically. What has been their experience right now? Again, I was working with a lot of recent immigrants from Somalia, the Sudan, I had to think carefully. These kids were coming from refugee camps, right? It didn't seem fair to suddenly be like, oh, they have special education needs. What they really needed in Minnesota had this great program called Early Childhood Family Ed, which was kind of akin now to your universal TK programs. And so it's like, give them some time, get them into a program, have proper nutrition for a few months. So again, these are not trivial things that we need to consider in children that definitely impact their development all the way through. It's not just about early childhood, it's about all throughout childhood. And then for peoples with low incidence disabilities, again, if you might immediately be like, yes, this is a child with Down syndrome, this is a child who has an intellectual disability, really think through their need for specialized services, materials, and equipment, and those services in their home language. So emphasize that when you are writing their IEP or writing their evaluation report, make recommendations about services in their home language. I'm going to give an example. Think about augmentative and alternative communication. How often do our specialists only provide those in English for the classroom, but they don't think about that families need to communicate with their child that might have severe communication disability and is in need of augmentative communication. Here are our specialists doing all in English, but there's nothing in the evaluation report about providing those services and the need for that in that child's home language, which therefore means it doesn't show up in their IEP or the IFSP. This is critical that we write this in our evaluation reports. In addition to these minimum requirements, it's best practice for assessment reports for English learner students to include the following documentation: the impact of language, cultural, environmental, and economic factors in learning, how standardized tests and techniques were altered. So your law says, tell us how you changed that process. What did you do? How did you use interpreters, the translation of tests? Include a statement of validity and reliability related to their use. That could simply mean we had a Woodcock-Johnson, we gave these sections in Hmong, we altered it, the process, they're no longer valid, but here's the information we gathered. The student could do this, but not this. The student could do this, but not this, right? So it's more of a narrative approach to describing what the child could do. And then they want in your evaluation reports to the examiner's level of language proficiency in the language of the student and the effect on the test results and overall assessment. So who did you have administering that test in the child's home language? What was their proficiency? And document that in your report. All right. So that's the information I had for today. I hope I didn't go through it too quickly. I was feeling a little bit rushed.
You did absolutely great, Lillian. Thank you so much for your presentation. And we do have a few minutes for questions, so we can go ahead and do that if that works for you. Does that sound good?
That sounds great. Yeah, I love taking.
Excellent. Okay, great. So before we do, just a quick note to our attendees, please complete the survey by pulling up the QR code, and we'll also post the link in the chat. So Dr. Duran, the first question that we have in the chat is, what do educators need to know to avoid over-identification or likewise under-identification into special education of multilingual learners?
I'm so glad you asked the question that way, right? Because disproportionality is about both of those. What research tells us is that actually in early childhood special ed, multilingual learners are under-identified. And that is often because of this hands-off approach, like still that myth that exists in the world that bilinguals are somehow delayed. And so, oh, this is just typical for a bilingual student or a multilingual student to show these delays in each language. Instead, in early childhood, we really, number one, again, need to really think about that family voice. Have we conducted outreach to understand if that family has concerns in that child's home language and within their cultural norms, right? So that's one thing to reduce under-identification early childhood. Also, community outreach. So much of the outreach around early childhood services is in like WIC clinics, other public health arenas, areas where we can reach out to families where they might be experiencing understanding that or reaching out to get services. Pediatricians in your community are another area where we can reduce under identification of disability in multilingual populations. So that's that part of the question. To reduce over identification, we really need to think through this multi-data source, right? Gathering multiple data sources. We can't rely on our standardized scores. And I know so many of us have been trained to really look at that minus 1.5 standard deviations or 2 standard deviations below the mean, but understanding that that's systematically flawed when we're looking at multilingual learners because these tests were not normed on that population. So it really violates the standardization process. And again, we have to use our team-based approaches, our professional knowledge, which is baked into our laws federally, and it's also baked into your state laws. So it's understanding your professional competence at putting together that multidisciplinary team, looking at multiple data sources, and looking at data source over time, right? Within MTSS models, we've become much more accountable to looking at, we have we have an initial data point, we can look at whether or not that child has made adequate progress. And so make sure that you're working with your team to look at those issues to reduce over-identification.
Excellent. Okay, another question that came up is what is the guidance when an English speaking student is, English language speaking, let me see. Okay, I'm going to back up. What is the guidance when an English speaking student is signed up for a Spanish dual immersion program and the home language survey indicates red flags for reading development?
So there's a lot of questions about this, like should students who are monolingual English speakers at home, who are in a dual language program, who might have some issues with reading development, continue in that dual language program? Is it supportive or should they go back to monolingual English? I mean, these are complicated questions. So again, there's no silver bullet here. I'm going to describe an information gathering process, right? One, what are the services? What is the instruction like in that dual language program? They vary quite a bit, right? I'm going to say from research, there's no reason to pull that child immediately. Our brains can learn more than one language. We're fully adept at that. In the United States, we have this false perception that our brain's going to fill with one language and there's not going to be room for the other. Like just this complete lack of understanding of neural plasticity and language learning early in development. So I'm just going to say that out loud, right? So there's no reason that child can't be multilingual, bilingual, and work through a possible reading delay or some issues around needing some extra support with reading, learning how to read. But we need to make sure our services are adequate and recognize that child's need in a dual language program. So is there a reading specialist they can work with? Is there a teacher that's adequately trained around reading instruction? What curriculum are they using? Does it include enough direct instruction around basic reading skills to make sure that they're learning those basic skills? Thinking about the program's approach, are they teaching to read in I'm just going to use Spanish as an example, Spanish and English, or are they only choosing one language at a time to teach reading and then gradually introducing the other? So all of these would be questions you'd need to ask. And then also that family's choice is another piece. Like how much can they support their child's reading development in this dual language setting versus a family that may be less resourced or have more difficulty with supporting their child, right? So these are all the issues to sort through. I don't think there's a silver bullet there, but I think my main answer to this is don't pull that child immediately falsely thinking that it's too hard for them to learn in 2 languages. It's really more about what supports can we offer to that child and are they adequate and effective?
Okay, excellent. Another question is if a teacher has a student they are concerned about who is a multilingual learner, how can they best advocate for students through the school and support the parents to ensure they're getting the language and literacy support and/or intervention they need?
Well, I think, I supplied that report from you because that comes right from your California Department of Education. I would be well versed in what your Department of Ed recommends. They have strong recommendations in there around supporting home language development, around recognizing the needs of multilingual learners both linguistically and culturally, and really thinking through that you before referral these they have a whole chapter on pre-referral interventions and the need to document those and to provide some intervention support in that child's home language and to document that. So I would lean on, as you're advocating, download that manual and bring those chapters to your multidisciplinary team and look, say, I'm just trying to follow the law here. I'm not trying to do something that's out of the box thinking or isn't evidence-based and recommended. And so this is the bridge of research to practice, that happens. So me as a researcher, right, I'm just thinking about these things, design writing about the things, and then the, Department of Eds put them into real practical application. And then that practitioner is where the rubber hits the road to actually enact those policies and those procedures that are meant to happen. So I really encourage you to lean on that document, pull it out, and advocate based on the law that's presented in your state.
Great. Another question is there an illegal requirement or specific California Ed code that could be used in having a district utilize translation services?
I think, the federal government in IDEA, it says that results are supposed to be communicated with families in a form or mode, again, that is best understood by them. I'm not remember the exact legal language right now. I'd have to look up. But essentially, it's like we're supposed to provide information to the family, again, to fully realize due process in a language that they understand. Pretty common sense. And so if you went to that law, I mean, if you just Googled IDEA, family due process, it would come up that the law there. It's also in that manual around looking at translation services. Now, we doesn't mean that we have to provide material in a written form, like translating the whole evaluation report in the child's in the family's native language. That can be done on request. There's different interpretations of the law around translating a lot of those written documents that are like the evaluation report or the IEP, but certainly all of the due process forms have to be in the family's native language, like the invites to the meetings, um, formal notifications throughout due process. And so I think you can lean on the law there that you really need to engage. Translation is about written materials, interpreters about spoken communication. So about engaging both of those.
Okay, great. Are there any particular tests that you encourage school psychologists to look to when they're working with multilingual learners
Well,
in an evaluation?
yeah, so for school psychologists, certainly some of those nonverbal, it depends what you're testing for, right? We've got 13 uh, doors into special education. And so, this varies quite a bit about what you're looking for. If a school psychologist, I'm just going to give one example. If you're looking at something like intellectual disability, the recommendation is looking at nonverbal tests like, say, Raven's matrices, where the language burden is reduced in those kinds of tests, or looking at the cognitive sections of tests carefully to see how much language is embedded in the testing, because you want to reduce the language load and increase the load on cognition in order to have more of a fair and least biased assessment. But again, to answer this question, I'd have to know which eligibility criteria are you looking at, and then the tests that are available. Know that most of them are limited. I think that is the take-home message, and just understand the limitations that they have, acknowledge them, and then work with the information that you gather.
Wonderful. Is there any thoughts that you have or things you'd like to share with California educators as they're about to start implementing California reading risk screening for K through 2 students relative to their multilingual learners?
Yeah, I think it's an exciting time. I'm a bit of an optimist, right? Got to be optimistic. I think it's an exciting time where we can do right by California's children, right? We can really find those kids early on, intervene early. Too many, let's just be honest. You look at California statistics, I'm a native Californian, love the state, but too many kids are falling behind and not reading well by the time they get out of California public schools. And that breaks all of our hearts because we know how important that is to lifelong success, right? It's one of the cornerstones of lifelong success is being able to read and read well and process information and be a critical thinker, right? All of those things. And that starts early on with basic decoding, being able to read the words on the page, being able to read fluently so that you're comprehending fluently and can really access the information that you're reading in a critical and enlightened way. So I say be excited about it, but have a cautionary tale, right? Think about what assessments did my district choose to use? Do they really work for the population that I'm assessing right now, right? Are the scores valid, right? Or do I know something about this child that contradicts the score that they're receiving? use the knowledge of your child as first and foremost because you see them all the time. You see their progress over time. In the multitudes development process, we normed it on California, but there are other assessments out there that can provide equally, valid information. Your district has decisions to make. Um, so think, if you could be part of the process that decides what assessment might be adopted, join the team, have a voice at the table, and really think through your options here. Once the child is identified in screening, that's of course not the end. We're not identifying disability. And I really want to make that clear too. Too often the arguments around this have been like, we're going to over-identify disability. A screening is just a screening, right? It just says, hey, something could be going on. So then follow up and have processes in place. Really think through what are we going to do differently now if a child is flagged? How can we approach their learning in a different way that helps them to be more successful versus we're going to go down the road of a special education eligibility determination? So I think a lot lies on the professionals involved in that process and thinking through the screening you choose, how it relates to your population, really interpreting those results fairly in the context of that child's development and their culture and their language. And then what you do next is absolutely the most important step. What do you do differently that will effectively address that child's needs?
So to support that, what you do next, do you have any resources you'd suggest that would be easy for general education teachers to reach for, specifically related to supporting their English or multilingual learner students?
That is a very complicated question, and I wish I had another 30 minutes to
You have 5, so you can take the
five.
whole
All right.
thing.
There again, in the multitudes platform, there's a whole section on interventions and things to try. So if they score low here, you could go here, right? Other assessments have those kinds of platforms too. It's like if they give some instructional recommendations. So go to those, right? So if you are adopting a screener, that might be a question you ask. Do they have instructional recommendations that follow up, that provide information once that child has achieved a performance level on that particular assessment? Uh, there aren't these perfect curricula out there, tier two curricula that are like perfect for multilingual learners or there is a website I would go to. It's called Project Elite. I don't know if someone can look that up or Project Eclipse. If you just type in MTSS for ELs, it's that project was led by some colleagues of mine. It was a demonstration project. Sylvia Lynn Thompson, um, Amanda Brown, and a few others here in Oregon led this and nationally led this amazing project where they really tried to put together resources for those kind of tier two interventions. Like the child now is in an MTSS system. They've been screened and they have some educational needs, particularly around reading and literacy or reading and language arts. So I would go to that website. Maybe you could put it in the chat, and they have different practitioners guides. The U.S. Department of Education also has a fantastic practitioner's guide around ELs and reading and literacy development. If you go to the U.S. Department of Ed, they have practitioner's guides. If you look up ELs and reading, it's a little bit older, but it was really developed by some fantastic leaders in the field, David Francis included. And I would look at those practitioners' guides. Regardless of whatever curriculum you're using, there's some discrete kinds of activities and instructional methods that you can use with multilingual learners that are embedded in those guides. And the last thing I'll say about that is really attending to that child's English language proficiency. Too often we give that an afterthought, right? Just because the child is emerging in conversational English doesn't mean they're ready to learn in English. And our English learners are tasked with learning English while at the same time being mandated to learn in English. Nobody could do that. I couldn't go to Russia tomorrow and learn Russian and be in a graduate class in Russian and get anything from it. And yet these students, time and again, they're put in this impossible position. So instructionally, I really encourage you to adapt your English language instruction to their level of ability while they're gaining proficiency. And then also think about, to the maximum extent possible, how do we provide home language support to that child so they can continue to develop their vocabulary, their cognitive development in the language that they know best.
Well, that is wonderful. Thank you so much, Dr. Duran. This was an amazing presentation and so timely for California's educators. We are done for that session for today. We will take another 10-minute break. And when we return, we will be back with Dr. Jessica Tost, who will be speaking about using assessment data to provide intensified tiers 2 and 3 support.
Mhm.
So thank you so much for your time today, Dr. Duran.
Yeah, thank you very much. Take care, everyone.